Hi, I'm Brooke, and my topic today is sleep apnea. Sleep apnea is a common condition in which your breathing stops and restarts while you sleep. Snoring or gasping for air during your sleep, or other symptoms like waking up after a full night of sleep and still being tired, can be caused by sleep apnea. Patients with sleep apnea are at a higher risk for car crashes, work related accidents, and other medical problems.
When we breathe, air travels down the throat, through the windpipe and into the lungs. The narrowest part of that pathway is in the back of the throat. When we're awake, muscles keep that opening relatively wide. But when we sleep, those muscles relax. That narrows the opening. The air passing through may cause the throat to vibrate. That causes snoring. Obviously, many people experience this. But in some people, the throat closes so much that enough air doesn't get through to the lungs. When this happens, the brain gets a message to wake up. The brain quickly activates the muscles that hold the throat open. Air gets through again, and the brain goes back to sleep. This only takes a few seconds. You may not even know you've awakened, but this process may happen over and over, hundreds of times, all night long. You may never get into the deep, restful stage of sleep. As a result, you may feel exhausted when you wake up and feel sleepy all day. Many mistakes and serious accidents are caused.
Symptoms of sleep apnea include loud snoring, episodes where breathing stops, gasping for air, waking up with a dry mouth, morning headaches, insomnia, and excessive daytime sleepiness. A diagnosis of sleep apnea can only be made after a sleep study confirms you are experiencing breathing problems in your sleep and that other sleep disorders have been ruled out. In order to determine whether you need a sleep study, a doctor will perform a physical exam and ask about symptoms and family history. Some of the questions they'll ask are: do you feel tired during the day? Do you take naps? And if so, how long are your naps? Is it difficult to stay awake while performing tasks like driving, reading, or watching TV? And has anyone in your family been diagnosed with sleep apnea? A polysomnogram is a type of the sleep test, and it is a medical device that's used to monitor a person's breathing, heart rate, and electrical activity of their brain waves while they sleep. The home sleep apnea tests take fewer measurements than an in-lab sleep study, so less people use the at-home tests. The diagnostic criteria for sleep apnea is when airflow stops for 10 seconds or longer. Hypopnea is period of shallow breathing that lasts for at least 10 seconds and causes a drop in the oxygen level in your blood. And respiratory effort related arousal is when breathing becomes more forced for a period of at least 10 seconds and disrupts sleep. There are 3 different types of sleep apnea, which are obstructive sleep apnea, central sleep apnea, and treatment emergent sleep apnea. Obstructive sleep apnea is the most common type. It happens when the upper airway becomes blocked during sleep, when the muscles in the back of the throat relax. When the airway is blocked, the oxygen levels in the blood decrease, which your brain will sense and wake you up briefly. But the waking up is usually so brief that you won't remember it in the morning. This pattern can repeat itself 5 to 30 times or more each hour, which makes it difficult and nearly impossible to reach the deep and restful phases of sleep that you need. Obstructive sleep apnea can also reduce or completely stop airflow to the lungs. And there's a link between obstructive sleep apnea and cardiovascular disease, chronic heart failure, hypertension, obesity, and impaired gluten intolerance. Risk factors for obstructive sleep apnea are obesity, neck circumference, large tonsils, or changes in hormones. Central sleep apnea is the less common form of sleep apnea, and it happens when the brain fails to send signals to your breathing muscles. You may awaken with shortness of breath or have difficulty going to sleep or staying asleep with central sleep apnea, and its risk factors are being older, being a male, heart disorders, using narcotic pain medicines, and stroke. Treatment emergent central sleep apnea is also known as complex sleep apnea, and it happens when someone has obstructive sleep apnea, then converts to having central sleep apnea when receiving therapy for obstructive sleep apnea. The complications of sleep apnea are daytime fatigue, which comes from the repeated awakenings, which lead to poor quality sleep. High blood pressure or heart problems happen because of the sudden drops in blood pressure, which put strain on the cardiovascular system. Type 2 diabetes is also a complication. Metabolic syndrome and liver problems, which are normally non-alcoholic fatty liver disease. 10 to 15% of males in the United States have sleep apnea, and 10 to 15% of females have sleep apnea in America. Sleep apnea has been recognized throughout human history as far back as 4th century BC. Reports from the 19th and 20th centuries gave way to systematically conducted studies on patients. People with sleep apnea have a lower peak oxygen uptake during aerobic exercise than people who do not have sleep apnea. People who suffer from sleep apnea are more likely to be obese and have reduced aerobic fitness when compared to people with similar BMIs who don't have sleep apnea. And sleep apnea is believed to cause structural changes in muscles that contribute to difficulty exercising. Exercise can improve subjective perceptions and objective parameters of sleep, which are total sleep time, sleep efficiency, and duration of slow wave sleep. An exercise program that reduces body weight and abdominal fat can reduce symptoms by 30%. Sleep apnea treatment is usually lifestyle changes like quitting smoking, weight loss, and use of a breathing assistance device or CPAP. Surgery is not tolerated by many patients because their bodies can't handle it. And there are medications for sleep apnea, but the side effects are things like drowsiness and nausea and headache, which won't really affect the long-term exercise ability. For my case study, Mr. S is a 55-year-old sedentary male who has been diagnosed with obstructive sleep apnea. Mr. S is 5'10" and 200 pounds. The goals for Mr. S are to start an exercise program and lose at least 10 pounds in order to help with his sleep apnea symptoms. A cardiopulmonary exercise test should be done on Mr. S to determine if there are abnormalities in lung function, which is common in patients who have sleep apnea. So, as far as exercise prescription goes, studies show that exercising at least 3 days a week for 30 minutes helps with symptoms of sleep apnea. And from the chart on the right of the screen, the first exercise program, it was a 24-week aerobic and resistance exercise plan. It consisted of 3 sessions a week for 30 to 45 minutes, and it was found to have reduced the number of wake-ups throughout the night and reduced BMI, and also improved aerobics capacity and quality of life. But with all of these exercise prescriptions, they all had positive results. It is common for people with sleep apnea to be overweight, so a cycle ergometer may be used instead of a treadmill for people who have trouble walking. Smoking could be a part of the client's life, and it normally is with people who have sleep apnea, so their lungs could be compromised even more. And it is also important to take note that sleep apnea may cause structural changes in muscles, so that will make it even harder for your client to work out. In conclusion, the American Sleep Apnea Association considers exercise as a non-pharmacological treatment of sleep disorders. When a client has sleep apnea, it is important to know which type they have, because that can change what type of exercise programs they'll be able to complete. And also, because sleep apnea symptoms happen while sleeping, many people do go undiagnosed, so you might